Hello, I'm Ben Smoke and this is The Lock-In. This week we'll be talking to a frontline NHS doctor, asking her about the gap between what the government's telling us and the realities on the ground, and what we can do to help bring the crisis to an end sooner. Check it out.
The big question now is, how do we emerge out of lockdown when, for example, we don't have a vaccine? We need to sort of have an idea of what that exit strategy might be. I'm wondering if it might be, okay, we'll let some other countries in Europe do it first and then see what works with them.
In terms of those strategies, which ones in your eyes are the ones that are really working, are the success stories?
A strategy that we've just not spoken about is testing and tracing. We've seen that it's worked in South Korea. New Zealand acted really quickly. They've managed to completely contain their number of cases. The most rapid increase in death rates are Italy, Spain, the UK, France, and the USA. All of us haven't implemented test and trace policies. For me personally, I think that's the only way that realistically we're going to get out of lockdown in any sort of timely way.
And on that question of testing, how do you feel as a medical professional about the lack of testing for people on the front lines?
I came down with symptoms of coronavirus about 2 weeks ago now. I am now better, but I didn't know if it was coronavirus, if it was a cold. At that point, testing wasn't available to me. I ended up staying at home for about 10 days. I was one of a quarter of the health workforce that was at home because of either having symptoms of coronavirus or a family member having symptoms. And at a time when we need all hands on deck, that seemed to be a bit ridiculous that we couldn't access testing, especially when you see that politicians, footballers, actors do get testing. But actually, there does seem to be a turnaround with that. So I've got a couple of friends who've come down with symptoms this week who are health professionals, and they have been able to get tested. So it looks like there has been some movement on that.
What can people do to protect themselves, to protect everybody else, and to help frontline medical staff deal with the crisis?
We're pretty limited with the options that we have. The only one that we have is social distancing. I know it really sucks to be inside when it's hot and sunny outside and there's a bank holiday, but the numbers don't look fantastic, and it just requires all of us to pull together. It's so tragic reading about every death, but especially the deaths of key workers and frontline workers, some of whom are pretty young actually and don't have underlying health conditions, and they're going out there and putting themselves on the line. And I think it's just a reasonable ask that all of us try and pull our weight where we can, and trying to social distance this weekend.
It's so critically important that we all, as much as we can, try and stay indoors. That means finding things to do. We've collated a whole list of incredible documentaries for you to search through, maybe learn something. If you're still not finding any inspiration, get in contact with our sister publication, Little White Lies. They're doing a movie matchmaking service. Just send them some details, what you're looking for, and they'll ping you back the perfect movie for you. As ever, stay safe, stay healthy, and for God's sake, stay indoors. Subscribe here, or here, or here, or here. Oh, where are you going?